is the Emergency Medical Minute.
Testing. There we go. All right, so this is just a super mini medical minute. Sore throat. So sometimes for strep, we'll do things like center score. So that's if like person has lymphadenopathy, fever, absence of cough, et cetera, to determine if we need to do strep testing. There actually are some predictors for mono, whether or not we should do mono testing. And so this is a paper where they looked at a conglomeration of different studies. I think there was 670 abstracts, and they looked at 117 papers. So a huge number of papers, like what are the predictors for people having mono? So you kind of learn that people have like a ongoing sore throat. They might have monocytes in their blood, or they might have like palatal petechiae. So they looked at all these different things. So palatal petechiae, the sensitivity was 0.25 to 0.27, so not great. Posterior cervical lymphadenopathy, so instead of having lymph node swelling in the front, it's more on the back side. That was slightly more sensitive, 0.64. Inguinal or axillary lymphadenopathy was also useful, and atypical lymphocytes greater than 10% on a CBC were useful. So the other thing you need to know is if someone might have mono and you do a mono spot test, if you do it early, a lot of times it's false, like the false negative rate can be like up to 25%. So some of these other features can help determine if someone has mono. The follow-up question is, why do we even care if someone has mono? Well, we care, but we sometimes don't care with as much intensity as some other diseases maybe. And the reason is there's nothing really to do about it. You just kind of wait it out. You always tell people, well, avoid sports, because if you're like a high school lacrosse player and you're hit to the side and you can hit your spleen, you get splenic rupture. I've actually never, ever seen splenic rupture ever in my career, and I know I'm kind of new at this, but has anyone here ever seen splenic rupture? I think it's a very rare complication. So anyway, I thought these predictors were kind of a nice little tool that you could use instead of doing the mono spot. Anyway, very short one. Thanks.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.